Did you know that as human beings, we have absolutely no say in whether or not we get programmed? Most of the time, this is by default, programmed by society, the media, our culture, parents and family, authority figures. But we absolutely do have a say when we have this awareness of how we get programmed or what we allow to program us. So, welcome to this fourth episode in a monthly series I'm calling Positive Programming for Cancer, where you will hear real life, true, inspirational success stories of cancer patients who healed themselves against all odds. What did they do? What's different about them? In some cases, it's clear, in others, not so much at all. Either way, the more your brain hears these types of positive success stories, the more you will believe and come to know that it is possible for you too. That's just how it works. So join me for this series monthly. And by the way, hello, I'm Dr. Lisa Matejka, naturopathic doctor, energy worker, and transformational life coach, and I help those with cancer navigate their journey back to health and wellness, actually to an even better state than before, physically, mentally, emotionally, energetically, and perhaps spiritually. So on all levels, with compassionate guidance and loving support. And today's story is from a woman named Charlotte Dubois. I think I'm bad with French, if that's even what it is, who later co-authored the book, The End of Cancer, with Dr. John Lubecki. This book, right here, which was published in 1995. So Charlotte actually worked in nursing as a medical assistant in a large hospital for over 20 years. So she bore witness to many a cancer patient's journey. Her lump was in the breast, and it was discovered at a routine checkup in 1985. She had the mammogram. It was about 2 centimeters. And it was recommended that she do a biopsy to see if it was malignant or benign. But she refused that because she had seen so many patients' cancers start growing rapidly after such procedures. She had also witnessed many false negatives. Furthermore, she was not about to do chemo, radiation, or surgery. She had witnessed plenty of chemo patients, and that was a horror to behold. She had heard the doctors say it rarely succeeds, but may prolong life just a little. Radiation was just as bad. This was no kind of life. And surgery, the seemingly least invasive, she also had seen weaken patients and their immunity to the point where the cancer could gain a foothold to proliferate. And she also knew the procedure itself could help assist its spread. She recalled one patient who was in such pitiful condition that his wife was wondering what would kill him first, the cancer or the chemo. They made the decision to quit conventional treatment and seek natural therapies, which allowed him to regain his health, vitality, and cure his cancer. When he came back, the doctors scoffed it off and said, "Oh, that's just spontaneous remission. That would have happened regardless of what you would have done." And just throwing these are all her words. This is her sentiment and her words, by the way. But I am just going to throw in a little something of my own. Any one of you that have been watching me knows how much I talk about Kelly A. Turner's work on spontaneous remission. And it does not just happen no matter what you do. There are specifically 10 things that have been shown that help you have a spontaneous remission. So anyway, back to the story. Learning of some of these success stories of her patients, she recalled some that had gone to a holistic clinic in Mexico. She went to this clinic later in 1986 for a non-conventional blood test, but for her it came back inconclusive. The doctor there said, if it is cancer, It's inactive at this moment and is slow growing enough that will not be life-threatening anytime soon. Come back in 3 months. At this point, she was still hoping that the lump was benign. Looking back on her overall health, it did seem to deteriorate 2 years before the discovery of the breast lump. Frequent headaches, pain in chest, legs, back, insomnia, depression, confusion, memory loss. And then when the lump was discovered, digestive issues surfaced as well as anxiety. And Charlotte was feeling less and less and less stable, both emotionally and mentally, feeling like she was on the verge of a nervous breakdown. She found it very difficult to go to work, but still had to grin and bear it due to financial stresses. Fall of 1986, her health went downhill even more and she became ill. She went back to the holistic clinic in Mexico, which did another one of those unconventional blood tests, which came back inconclusive again, but this time due to interference with an intestinal infection. She was told to come back when this intestinal infection had cleared. It was around this time that her breast lump started growing rapidly, becoming inflamed, swollen, and quite painful. It was very noticeable even through her clothes before she made the decision to come back to this clinic in the spring of 1987. Partially, she didn't come back because she couldn't clear this intestinal infection, and partially she didn't come back because she was afraid of the news. But she got the news from the test. She did indeed, according to this test. I don't even know what it is, doesn't say. She did get the news that it was indeed cancer. So her hope had been lost, and now she had to decide what to do. But she absolutely knew she was not going to do conventional treatment after bearing witness to doctors treating thousands of cancer patients and bringing suffering and poor outcomes. The holistic doctor at the Mexico clinic said her cancer was due to 5 things. 1, the toxic condition of her body. 2, breakdown of her immune system. 3, mercury poisoning from amalgam fillings. 4, severe infestation with intestinal parasites. And 5, candida, which is a yeast overgrowth. Now, the toxic condition of her body, referred to as number 1, was actually due to the parasites in the candida because those produce the most toxic waste than from most other sources, which is crazy, right? And this, of course, is also linked to the mercury poisoning because the mercury from the amalgams leaking into her body depressed and weakened her immune system greatly, allowing these opportunistic infections to take hold, as well as parasites. Her recommendation from this clinic was a good cleansing protocol, bee propolis from Germany, Laetrile, also known as B17, herbs, homeopathy, and diet. The diet was basically whole foods, plant-based, fresh fruits and veggies, herbs. Small amounts of turkey and fish were allowed, and raw unpasteurized butter, grains like millet, quinoa, brown rice. Absolutely not allowed was processed foods, fried foods, red meat, chicken, pasteurized milk, salt, and seasonings. Oh, she also was allowed small amounts of cold pressed oils. And of course, she was to have her mercury amalgam fillings removed, as well as crowns and a whole bunch of other dental stuff I'll get into shortly. The problem was this was all going to be very expensive, more than she could afford. And also she had no idea where she could get something like this done in the US, where dentists were not yet privy to this sort of thing. Remember, this is like in the 80s. But where there's a will, there's a way, and she found a way. Her mom was very supportive and more than happy to cover any costs. And a friend happened to know of a holistic doctor locally in California, who then happened to know, that doctor happened to know a more holistic-minded dentist that did understand the dangers of mercury and was able to remove it safely. She started seeing this local holistic doctor as well, who agreed with her plan from the clinic in Mexico and just added a couple more homeopathics, and also did electrodiagnosis, which confirmed that yes, she had the mercury poisoning, parasites, and candida. In the summer of 1987, this dentist also had been using electrodiagnosis and found the following 5 problems with Charlotte's mouth, which were then all corrected. Yes, of course, we have the mercury poisoning from the mercury amalgams, which were removed and replaced with a non-toxic material. The gold crowns had to be removed and replaced as well, not because there's a problem with the gold, but because there had been amalgam left underneath them, and that had to be taken care of. The porcelain crowns had to be replaced as well because the metal base was made from a nickel alloy, and nickel is a carcinogenic material. Any tooth that had a root canal had to be extracted because root canals oftentimes lead, and in her case did, to chronic low-grade infections, which are not good and weaken the immune system, lead to inflammation, which can lead to cancer. And she had to get cut out the amalgam tattoos, which is basically gum tissue that had been infiltrated with mercury. Those had to be cut out. After her cleanse, the tumor stopped growing, but it took a little while to shrink, 2.5 months, which actually I don't think is that bad. The tumor started shrinking when she started getting the dental work done, and it corresponded to this. When she got the largest parts of the mercury removed, that's when it really began shrinking more rapidly. And by the time the dental work was all done, her tumor was the size of a pea. These non-conventional blood tests and electrodiagnoses showed no evidence of disease, no cancer. And that's perhaps not even the best part. The best part is she felt so good. She had not felt that great in years. All those symptoms I'd mentioned that happened years before the breast lump was discovered, all those symptoms gone. Her journey had instilled in her not only a fiery passion to help and inform others, but a sense of her duty and purpose and mission. This is a common, beautiful theme of those who get cancer. They find a way out and are inspired to help others do the same. Their greatest fear or foe ends up their greatest gift. So what was it that did it for Charlotte? To me, her case seems to emphasize and be a great example of the importance of cleansing toxins from the body so that it can regain its own natural healing capabilities. This was back in the 80s, but even recent cancer conferences I attend are still pointing to all the evidence of the connection between parasites, candida, and cancer, as well as oral hygiene. Now we especially know the connection with the mercury amalgams and root canals. And yeah, so there's some good stuff in there. But perhaps it's also her spirit. She found a way. And that brings me to something I kind of alluded to before. There is research on spontaneous remission by a woman named Kelly A. Turner, who has, I don't even know how many thousands of cases. She's been studying this for decades, and she did narrow down and find 10 statistically significant common healing factors among these cancer patients who had spontaneous remissions. So basically, she found 10 things that everybody with spontaneous remissions had in common. So it's not like that doctor said that Charlotte knew where, oh yeah, if you're going to have a spontaneous remission, that's just going to happen no matter what you do. Not true. And if you'd like to know what those 10 factors are, I'll leave a link in the description box that you can click to get your free gift, which is an article that I wrote summing up this research. It's a pretty article with pictures and stuff, so a pretty easy read, entitled The 10 common healing factors among cancer survivors who beat the odds. If they can do it, so can you. And that's the whole point of this program, y'all. Positive programming for cancer, to show you that there is an endless amount of these stories. And if they can do it, really, so can you. So keep listening to these kinds of stories, seek them out, read them, and also get your free gift, and also like and subscribe so we can reach more people and help even more people. I guess it's called follow on Rumble, not subscribe, but you get the idea. All right, so much love, everybody, and until next month.